The World Health Organization has categorized obesity as a disease since 1943.
Wow.
In the United States, the American Medical Association only in 2013 accepted obesity as a disease.
Wow.
Prior to that, we were thinking it was just a behavioral problem, right? It's not. It is actually a health problem. So I think now the thinking, even from healthcare providers, is switching, right? So now we can offer more things to the patient.
Hello everybody and welcome to another episode of New York 100. I appreciate you clicking through that video. I'm going to have a full-blown conversation about your health and what you can do to build healthier habits around your eating, your diet, your metabolism. So stay tuned for the whole interview. If there's a specific question that you want to just jump on, I'm going to leave all the show notes and the timestamps in this video. So if you're watching this on my website, go on YouTube so you can actually see the timestamps. And so you can get a specific answer to a specific question that you need. And it's about your health. So stay tuned for this whole conversation if you just want a better insight about you. So today I'm sitting with a very special guest. I mean, just amazing. I emailed her, very quick response. So I love that. I love the promptness and I love the professionalism. Dr. Salas.
Hi.
Nice to meet you. And let me just give a little background on her before we do this conversation. So 14 years industry professional in the field of endocrinology, originally from Mexico, came here to the States and studied in Johns Hopkins University, then Albert Einstein School of Medicine. And then she's fully certified. She's certified in internal medicine, endocrinology, diabetes and metabolism, and of course, obesity medicine. So we all know somebody that's been affected with either diabetes or obesity. We're going to dive into all that today. Thank you so much for coming and for sharing this discussion.
Thank you for inviting me.
And so first, I just want to ask you, so how did you actually get into the field of being a doctor? How did you become a doctor?
Since I can remember, since I was little and my father's memories, that's the only thing I wanted to be. When there was like the question of being something when you grow up, I always knew I wanted to be a doctor. So there was no other option for me. It was just, I'm going to be a doctor.
Was that based off maybe your parents or like you just kind of knew? Like
I'm the first doctor in my family,
Really?
in both my parents' sides. So it was just, I always wanted to see how things work. How the body works. I was always like, how are we functioning? How can we think? How can we dream? So that drove me into medicine, into wanting to be a doctor, to try to figure it out. How are we alive? How everything works inside of us.
And so when it comes to medicine, there's many different practices, many different areas. Did you dabble around in different, so what type of practice did you study before? And then how did we get to endocrinology?
Yeah, I guess when you're in medical school, your first decision is, am I going to go the surgical path? And then from there you have many subspecialties, or I'm going to do a medicine with meaning not surgical. So I like to be talking to the patient. I like to be out with the patient. I didn't like being in the OR for hours. Surgeons love being in the OR. Is one of the things that people go into surgery. I don't. I wanted to be able to move freely. So that made me go into medicine. And then in Mexico, diabetes is the #1 cause of death. So if I was familiarized with one disease since childhood, I think it was diabetes. My grandparents had it. I mean, everybody knows somebody who has diabetes in Mexico. So because of diabetes, I thought of endocrinology once I was in medical school. Once I saw endocrinology and understood endocrinology and what it's involved more beyond diabetes, that's what catch me in medical school. I knew I wanted to do endocrinology.
So endocrinology is quite a new word for me. I didn't know what it was until I actually started doing the research on you. So maybe you may or may not know what it is. I'll give you a background on what it is. So endocrinology covers practices from obesity, diabetes, thyroid cancer, post-bariatric, how do you say that?
Post-bariatric surgery.
Post-bariatric surgery, vitamin deficiencies, hormone changes. So that's just my brief overview. There's a lot more on it. So so can you just introduce people, what is endocrinology and how does it relate to them? Why should I care about that?
Yeah, definitely. And I have to tell you, you're not the first one that tells me endo what.
Yeah.
So yeah, so it's endocrinology, and what it does, it studies the function of hormones. And a hormone, it's a molecule produced in glands that travels to different organs and tells them what to do. So it goes from brain to your abdomen. So we deal even with some brain tumors, with its pituitary tumors. We deal, of course, with diabetes, thyroid disease, female and male hormones, so menopause, PCOS, testosterone deficiency, bone. Bone is a hormone system. It's a metabolic system. So we deal with osteoporosis, some certain bone diseases, and then nutrition. So vitamins, minerals, deficiencies, excess production, and the complications.
So is it the treatment of this? Do you treat this? Do you prevent it?
That's a great question. Okay. So we treat.
Okay.
We treat diseases.
Okay.
Prevention, only certain things you have control to prevent, which could be diabetes, could be obesity, but basically everything else besides that, it's treating it.
All right. So this covers a lot of areas, and today I want to focus on more so just obesity and diabetes. I think obesity affects here in America, and like you said, diabetes affects your hometown back to Mexico. So I want to focus on those two areas.
Definitely.
All right. So I really want to talk on obesity first, though, because it's such a prominent issue here in the States. And I was starting off with a topic that everybody can relate to, and that's belly fat, right? So you said belly fat is a visceral fat that's attached to some of the organs, so it's deeper than just the stomach, right? So first off, how does belly fat accumulate?
So, yeah, that's a great question. It has to do with your metabolism. It has to do with genetics, lifestyle, behavior. So the belly fat or the visceral fat is the one that attaches to the internal organs. So that's when we see all the complications of obesity, right? So heart disease, diabetes, cholesterol, everything that derives from obesity, and the worst is the belly fat or the visceral fat.
So you said it can be genetic?
Definitely.
It's based off our diet as well. So can you just remind people or just what types of diets can actually play into that? Types of foods, maybe types of things that can play into building that belly fat? So
obesity medicine has changed a lot in the last few years. We now know obesity is a chronic disease. So it's not just a behavioral problem. Obesity can be due definitely diet, exercise, but genetics play a huge role on it. Environmental factors, certain medications, and it could be a hormonal problem too. So it's not just what you're doing right or what you're doing wrong. It's more complicated than that.
So it can actually be genetic. So what is chronic? What is chronic disease? I don't know what's chronic disease.
Chronic disease, it's something that you don't bring it into you. So it's not something that you do to have it. Nobody chooses to have obesity. Right? So a chronic disease, it's something that will require treatment chronically, right? That it is not something temporary. It's something that will be there.
So I'm just a videographer, right? So I do need to kind of dumb things down, right? So you said obesity, no one chooses to be obese, but doesn't that can someone actually be born quite healthy and eat their way to obesity? Or
definitely. I mean, behavior, lifestyle, it's a big part of having obesity, but it's not just it.
So, I mean, I remember when I was younger, I used to just do 2 days in the gym and then everything will be gone, right? As I get older, that's not really the case, right? So how come belly fat in particular is so stubborn, right? And then how can one get rid of that? Because it's much harder to get rid of belly fat than other areas. I mean, when I try to put in the gym.
Definitely.
So how can we get rid of that belly fat?
Yeah, it's difficult. So whenever you see somebody working out a lot, you can really tell how healthy they are by looking at their belly.
Really?
Because you can have some bodybuilders, but they still have some belly, and that's 100% diet.
Oh,
right?
okay.
So you asked me how to improve it. Abdominal fat, usually it's related to nutrition.
Okay, nutrition.
Right? So the carbs, the sugars, the preservatives, that type of food is what can lead to abdominal fat.
Can a person be healthy with still having kind of a gut, or that's a real determinant of what's really going inside of you? Because you can look healthy, but is that like, as a doctor, you look at that and say, okay, that's really going internally, that's not healthy. What do you think?
Definitely.
Okay.
So we have something that is called metabolic syndrome. And one of the criteria for metabolic syndrome is waist circumference, right? So we have certain parameters that will tell us that if the size of the waist is larger than the certain number for men or women, that can tell us your health. Basically, it can tell us how healthy you are, or if you're predisposed to having certain health problems, including diabetes. So the example of the heavyweight that, yes, he's muscular and he's a boxing champion, but due to his abdomen, I can tell you he may not be 100% healthy. Right?
And you think it's due to his diet? So in that case, someone looks fit, but they have it's primarily diet.
It's not purely diet.
Sorry.
Genetics can also play
genetics
a part of it. Environmental factors can play a part of it. I mean, pollutants, chemicals, toxins, all of that can contribute to obesity.
Okay. So from my understanding, I've never been severe. I've gained weight before I traveled, so I've gained weight in the face. So I guess someone who's maybe in my position never been quite like severely overweight, we may be we may not understand someone who's obese or overweight. So I guess what part of it is actually genetic and actually having to fight against your own body, your own rhythm of your body? What part of it is that, and what part of it is behavior, And so what I guess what I'm trying to say is, to what extent does your physical biology play into obesity as opposed to like your behavior as well? So how does behavior? Do you understand what I'm trying to get at?
It's even complicated to ask it. It's complicated to answer it.
Okay, brilliant.
Because so let's get into it.
Okay.
So you can do everything that you know you have to do, right?
Okay.
You can eat 100% healthy. You can work out. But and let's say, as an example, a patient that comes to me and is trying to lose weight. If they do those things and they're able to lose weight, then you can say that was it, that was causing the obesity, right?
Okay.
But the main problem with obesity is that people are doing that. People are exercising, people are eating healthy, and the weight is not coming off. So in those cases, we can 100% say it's not just behavioral, it's just not lifestyle. There's other things that the person or you don't have control of it. And that's genetic, environmental factors, other things.
I think maybe someone who's probably obese or dealing with overweight issues, I think their shoulders just relaxed a bit because they can probably understand where you're coming from. For me or someone, we might not think that. It might just say, okay, go to the gym, but it's much more deeper than that. So let's just say they're going to the gym, they're hiring a personal trainer, they're doing all this and the third, they change their diet, they're working every single day. They're not seeing that. They're not seeing real changes in their weight. So what would be the next steps?
The next step is to see your medical provider.
Okay.
And ideally an endocrinologist or an obesity medicine specialist.
Okay.
Because there may be something besides those two things, diet and exercise, that is not letting you lose the weight. It could be a hormonal problem that it's affecting your metabolism. It could be a genetic problem. So those things we may be able to diagnose and treat. right? There's certain things that we won't be able to treat, like age, aging. Every year, your metabolism will slow, right? So for those things that we cannot directly treat, we have other options, right? Obesity medicine, as I said, has changed a lot, and the options that we have to help patients are more than go home, exercise, eat less, come back. No more. We don't do that anymore. And that lifts that heaviness or that pressure in the patient, right? Because you leave feeling failure. No more of that. We now know that it's not just what you are doing right or what you are doing wrong. It's more complicated than that. And as you said, if people are trying and they're not seeing results, it's the time to see your doctor.
That's beautiful to hear. And if you are in the New York area, visit Dr. Salas. We'll leave all the information below so you can reach out to her and, book a session with her, and hopefully you can, work things out. So do that if you're in the New York area or maybe the tri-state area, right? She's a professional, right? So let's talk about this. People overweight, even just myself, right? I'm gonna talk about myself. So I work long hours. I'm sure you work long hours as well. And then I guess lately now, I work long hours, I work hard. And so I don't mind the cheat snack. Right? I don't mind the comfort food, right? Because I love comfort food, right? So what would be your advice to someone who loves comfort food, who loves the junk food, who loves the pizza, all that stuff? So it's like, start to admit it, but because it's gonna lead really beautifully into my next question. So what is your advice to someone what type of foods that we can maybe transfer or take out for those junk foods or those cravings that we have? I have a lot of cravings for sugar. So I guess the first question is, why do I have all these cravings for sugar?
Okay, so cravings for sugar.
Usually when I work late at night, something like that.
So craving for sugar, your body is requiring energy, right? And then if you're working long hours, it may be your body telling you that it needs fuel. So one very important thing to understand is sugar is fuel in our body, is gas for our body. It's like a gas for a car. Sugar is gas for our body, right? So there's nothing wrong with that. Is when we have the excess of it, right? So one, if you're craving sugary things, it may be that you're craving some energy, especially if you haven't eaten for a while. But another thing that we have to take into consideration is that sugar craves sugar, right? So you may get into a vicious cycle by eating more sugary stuff. Your body will be craving more sugary stuff. So it's like an addiction, right? I do believe that sugar can create an addiction. So that's maybe a reason why you're craving sugars. Now, there are other health problems that people crave sugars. That when people are pre-diabetic, they may be craving sugars, or when people have diabetes without being yet diagnosed, craving sugar is one big sign of it. Okay, so let's just say it's midnight, I'm craving sugar. What would be, I guess, a replacement for that? Protein. Protein. Yeah, I always is replace protein. So I always tell my patients, I'd rather you have a piece of chicken breast than a bowl of cereal or bread or a pastry, right? So always try to replace protein. That will keep you satisfied longer. It will keep you fuller faster, and you won't have those cravings. So when you cut back a little bit of the sugar and the carbs, the cravings start to go down. Another reason why I say I kind of binge eat or eat at night, or maybe someone else might, is because of stress, right? So what role does stress play in, I guess, our hormones actually? Well, stress can raise anxiety, right? And sometimes overeating due to anxiety or eating, it's a way of calming yourself down. But it's not really the best choice to do it, right? Because that can lead to overeating, especially late night eating. It's the one that accumulates the most because at night we're not burning anything, we're going to sleep. So and I hear that a lot from patients is when they have heavy dinners or late at night. So that's the meal that may stay on you, right? So it's trying to avoid that. And to do that, the best thing you do is eat throughout the day.
Eat throughout the day.
Even if you carry a snack, right? So eat throughout the day. So late comes night, you are not extremely hungry, and that can lead to overeat, right? You asked me about stress. So stress releases cortisol. And cortisol, it's a good hormone. Cortisol has a bad rep, but it's actually, it protects us. It protects our body when we're going through physical or severe emotional stress. But the problem is when it's raised chronically, right? And if we have a lot of stress in our life, then our cortisol level may be running high chronically. This can lead to obesity also. It can lead to weight gain. It can lead to other metabolic problems like diabetes.
Okay, so first off, what does raised, because I know cortisol actually has a natural cycle. Can you speak on that? Can you speak on the natural cycle versus what is considered a raised cortisol?
Yeah, so the normal circadian rhythm is that our body produces the most of the cortisol early in the morning, like midnight to early morning, is because that's when we're starting to wake up. That's when we need most of the energy. And then throughout the day, it starts to drop. So like midday, we start to see a decrease in your cortisol, and that's the normal pattern of cortisol. The problem is when somebody's chronically stressed, it doesn't drop, right? It maintains a chronic elevated level.
And so at this level, so once the cortisol levels are higher, exactly what are some of the outcomes of that?
Weight gain.
Okay. And maybe the desire to want to eat more, is that correct?
Obesity.
Okay.
Well, it can lead you to anxiety, to stress, and that can have a psychological effect on food.
Okay. And then you also mentioned that you want to eat, it's best to eat throughout the day and not late at night. So how do you feel about intermittent fasting? Because that's quite popular nowadays.
Yeah, it is, and actually it works.
Okay.
And the key is intermittent, right? So it's not a daily fast. You can alternate 2 days a week, 3 days a week. You can do a fasting, and that like resets your metabolism a bit. And we do see, I wouldn't say major weight loss, but maybe weight maintenance, right? So you may not gain more weight.
So what is the difference between the standard American 3 meals a day versus the intermittent? And for my belief, it's in the morning, you fast throughout the morning and you eat. Wait, so what is the difference between the standard diet and the intermittent
So
fasting?
the standard diet is that we have breakfast, we have lunch, and we have dinner, and then some people have snacks in between, right? Okay. But intermittent fasting, it's meaning that you are going to skip one of those meals, and usually it's the breakfast, the one that we skip.
Okay, so one thing that I guess America is becoming, maybe throughout the world, is obesity is actually on its rise. I remember one of your articles, you said that when you first started out, it was like from 1 to every 10 people was dealing with obesity. Now it's like from 1 to 3. So why do you think, or what are some of the causes as to why obesity is actually rising throughout the years or increasing?
Well, because before what we know now about obesity, and again, this is very recent, we didn't have anything to offer patients. Patients felt that it was just up to them to do it, right? With the old
workout,
thinking,
exercise,
eating less, exercising more. It was not working. It's not working. And I think that's why obesity was on the rise. The World Health Organization has categorized obesity as a disease since 1943.
Wow.
In the United States, the American Medical Association only in 2013 accepted obesity as a disease.
Wow.
Prior to that, we were thinking it was just a behavioral problem, right? It's not. It is actually a health problem. So I think now the thinking, even from healthcare providers, is switching, right? So now we can offer more things to the patient. It's not just what you're doing or not doing. And the patient can feel more comfortable coming to us because now we can actually do something for them. So I think hopefully the next generation will have less of this problem. And the people that right now have obesity, they have to know that there's options now for them, that we can offer things for them, medication, nutrition. So hopefully they can reach out to us to treat obesity.
So does the definition of obesity itself lead to the rise of obesity based on numbers? Because the definition before it was a disease. I mean, before it wasn't a disease, it was considered behavioral. Now it's considered a disease as well as behavior as well. So originally I wanted to know, like, is there a reason why there's been an increase in obesity, or is it just because of the actual definition of it, or was it actual like patterns or like different diets that the American people have been taking on, or what's causing this increase in this influx?
I think it's what we're eating. It has to do a lot of the type of food that we're eating. It's not so much the amount. It's all this genetically modified food, all this processed food, also portion control here. If you travel other places beside the United States, you see the difference in portions. You come back home and you think, oh wow, this could be for 2 or 3 persons, right? So society and the way that we're living doesn't let us get out of that pattern because everything that is offered to us, right? So I think it starts at home a lot of times, educating the way that we eat, what we eat. We have to educate ourselves, read labels, read about nutrition, be a more informed consumer. I always feel when a patient informs himself, the most informed, they do the best. So we also have to take some responsibility. Yes, genetic has a lot of things to do with it, environmental factors, but 1/3 of that we can still control, right? And we have to educate ourselves.
And so this is why I really admire what you do and people of your practice, because you really, again, you're helping people. And so I guess as a doctor, how does it feel? Like, I know I get that sensation when I see one of my designs or a video and like some on a website, I'm like, oh man, I used my design, I'm so happy. What does it feel like when you have a patient that's improving their health? What is that feeling for you?
I mean, it feels great. I mean, that's one of the things that made me wanting to go into medicine is, it sounds just like cliche, right? Always like, oh, I want to help people. But yeah, when somebody is grateful that you made a difference in their life in a positive way, it makes you feel that you want to keep doing what you're doing, right? That you want to keep going, that you want to keep getting better and learning more. So it's always like a positive stimulus to keep doing what you're doing and improve.
And so what do you think it takes? I think I know based off this interview, but I want to ask you, because maybe you may or may not know subconsciously what I think is your greatest attribute, or one of your greatest attributes. But what do you think is a great attribute of a doctor?
Compassion.
Wow. Boom, spot on. I was going to say that. I was going to say empathy, compassion, that same. And so why is that so important? Because you even mentioned you didn't want to sit behind in the surgery rooms because you weren't able to, talk with the patients. So why is compassion such a great attribute, as a doctor?
You have to respect a patient. When a patient comes to see you, they're in their most vulnerable state, right? They're open to you. You have to respect that. You have to appreciate that. I think that's why it's so important to be compassionate, because you have to understand that that person sitting in front of you is nervous, is scared. They've probably been other places and they're not getting help, or they haven't been listened. So being able to listen is a big part of being a doctor. And that's one of the reasons that I decided to open my practice, was because I could have and control the time that I can spend with a patient. Sometimes unfortunately, and that's the healthcare system, sometimes we don't have the time to do that. But giving a person the time that they deserve, it's a big part. And
now you are your own boss lady, right? So what makes the doctor and what makes the boss? Because obviously I'm a creative, but then I'm also a business person as well. So what makes a great entrepreneur in you? Like what makes the great entrepreneur? Because there's a practical side and there's the business growth side. So what do you think is a great attribute in order to, start your own business and, do this on yourself and take the initiative yourself? What's that attribute that you need to take the leap and do this yourself?
I think, and I'm going to talk about myself, about my experience, but I think what can make you a great boss is being a prior employee, having worked before for somebody else. I think without that, it's very hard to be a good leader or a good boss. You actually have to be on the other side too and learn on the other side and see what things you would appreciate from a boss, right? And what things you don't appreciate. So when it's your turn to be on the other side, then you have to remember that. You have to remember that you were in the other spot and what was fair, what was good. And I always feel like if you treat an employee good, they'll respond good, and it will always be good for the business, right?
You were a great student, so that makes you a great teacher as well. And I can stay with you for a long time because really such a great conversation, very insightful. So last question I like to ask all of my guests: hard work or smart work?
Hard work.
Hard work, okay. Urgency or patience?
Patience.
Okay. And New York in one word.
Energy.
Energy. Thank you so much for watching this video. I truly appreciate it. Listen, it's all about your health. I know you want to tackle your goals. I know you want to get to the next level. I know you want to reach the highest heights, but you can't do all of that, any of that, if you don't have the greatest health, right? So that's what it's all about. Hopefully you've been able to learn a few things about yourself and just about health in general. If you know somebody who may need some help in this area, and maybe you can give Dr. Salas a contact as well. Again, you can reach out to her. Can you just share your social media handles one more time, please?
It's at New York Endocrinology on Instagram and Facebook. And my website is newyorkendocrinology.com.
Brilliant. Book a session. She's very inviting. Beautiful office. Great aroma. Smells really good in here as well. Good music as well in the mornings. So you'll have a great time here. So I appreciate it. Thanks for watching. And remember, guys, be great. Cheers.